Hi, welcome to NurseEdScholar. Heart failure questions on the NCLEX can feel, a bit overwhelming. You're thinking about crackles, edema, shortness of breath, low ejection fraction, medications, BNP. You're like, what is BNP? Uh, but understand the real question is this a fluid overload problem or is this a perfusion failure problem? Because, on the NCLEX, it's not testing whether you can recite left-sided versus right-sided heart failure. It's really testing whether you can protect oxygenation and circulation. So today, we're going to simplify heart failure the way the exam actually tests it. Okay, so let's begin. Now, what really is heart failure? The heart failure doesn't mean that the heart has stopped. It means that the heart is not pumping effectively enough to meet the body's demands. So that leads to two major consequences. Number one, fluid backs up. And then number two, perfusion decreases. So every heart failure question really becomes, is this, fluid overloading or overwhelming the lungs? Or is this the heart failing to perfuse the organs? And sometimes it's both, but one will be the immediate priority. Remember, heart failure becomes life-threatening when oxygenation drops, when blood pressure drops, when organ perfusion fails. Okay. So, let's look at, is this a fluid problem or is this a perfusion problem? Okay. And so let's kind of separate these. So when there's a fluid problem, there is, you're thinking congestion. You're focusing on congestion when there's a fluid problem. And so in your patient, you'll see crackles. So you'll hear crackles on auscultation, edema, JVD or jugular vein distension, weight gain, orthopnea, and an elevated BNP. You're like, what is a BNP? So a BNP is actually a B-type natriuretic peptide. Okay, and so what that measures is it measures a protein that's produced by the heart and the blood vessels. And when the heart is under stress or struggling to pump efficiently, that number goes up. Okay, and so under the fluid focus, the immediate danger is pulmonary edema leading to hypoxia. So your main priority with this patient would be to protect the airway and provide oxygenation. Now, in a perfusion problem, you're looking at cardiogenic shock. You're focusing on that. Your patient will have the signs of hypotension. They'll have cool and clammy skin, weak pulses, altered mental status, decreased urine output. Because the danger here is organ failure, because the body isn't perfusing. So the priority for this would be to support circulation and perfusion. And why do students miss questions like this? Well, students have a tendency of seeing edema and wanting to treat edema instead of really assessing the patient and noticing that their oxygen saturation is 85. Okay. Or students will see, they'll want to give diuretics, but they haven't really looked at the blood pressure that's 82 over 50. And so, uh, and so that's typically what happens with those types of questions. So let's kind of look at left versus right. Let's kind of simplify that. So, I don't really want you, I mean, I guess you have to memorize, but it's not about memorizing in nursing, because after you get past your fundamental courses, everything is application and memorizing, it doesn't work. You have to understand it. So, let's think of the direction of the backup, right? So let's start off with left-sided heart failure. So with left-sided heart failure, it's backing up into the lungs. That's the left side of the heart, right? So that patient will exhibit crackles, dyspnea, pink frothy sputum. That's late, but that typically that shows up on a test. In low oxygen saturation. And then the right side of the heart will back up into the body. So your patient will exhibit peripheral edema, hepatomegaly, ascites, and JVD, jugular vein distension. But on the NCLEX, oxygenation is going to outrank swelling. I don't want to say always, but I'm going to say the majority of the time. Because if your patient's not oxygenating, that will always be the number one issue. So when we're thinking of medications, because we always, nurses, we give intervention, we perform interventions, we give medications, we perform certain tasks. And students, students have a tendency of trying to memorize all the meds. They memorize the ACE inhibitors, they memorize the beta blockers, and you have to know them. You think of diuretics, you think of the ARBs, but the NCLEX wants you to think safely, because before giving a diuretic, you need to ask yourself, well, what's the blood pressure? What's the potassium? Is this patient already hypotensive? You know, Before you give a beta blocker, you need to ask yourself, what's the heart rate? Is this patient in acute decompensation, right? So you want to make sure that you stabilize your patient or make sure they're stable before giving medications. Because what happens, the exam, students always say, "Oh, you're trying to trick us," and it's not really trying to trick you. It's just trying to see if you can think critically through this particular problem. Because the trap is, you see, oh, 4+ edema, and you're like, "Oh, I want to give a diuretic," but not realizing that the oxygen is 85, or the patient wants to give metoprolol, but the patient's in cardiogenic shock. Their blood pressure is, I don't know, 80 over 50, you know. So you always want to look and say, okay, well, is oxygenation protected? How's the patient's perfusion? Is their blood pressure, you know, uh, elevated enough to handle the medication that I'm about to give? Because you want to protect oxygenation and perfusion first. Make sure that the patient is stable. Then give your medications. That's going to be key. So let's look at a case. Okay, you have a patient, they have heart failure. All right. They've gained 5 pounds in 3 days. All right. So students will be like, oh my goodness, they've gained 5 pounds. You're auscultating the lungs, they have crackles, their oxygen saturation is 88, and their blood pressure is 110 over 70. So what really is the priority here, right? And the answer really isn't, oh, I'm going to, talk to them about their diet, or what are you eating at home? The actual priority, and what you're going to do is you need to give them some oxygen. They're not oxygenated. They're not, they don't have enough oxygen. You need to give them oxygen. Oxygenation is poor, and you need to elevate the head of the bed unless it's contraindicated. All right. Because you have to realize hypoxia will kill your patient faster than that fluid retention. Remember that. All right. Second patient. Blood pressure is 82 over 50. So we got some cardiogenic shock going on, right? Heart rate 120, cool and clammy skin, decreased urine output. They are not perfusing. This is no longer just heart failure. Like I said, it's cardiogenic shock. So what's the priority? The priority is support perfusion, escalate cardiac care. You're going to call that rapid response team, and you are going to call your provider. So, when you're thinking about heart failure questions, and you're at the NCLEX, or, you're studying for, while you're in nursing school, when you come to heart failure questions, you really need to ask yourself, in the stem of the question, is oxygenation compromised? Is perfusion compromised? What is the patient's blood pressure? And what interventions prevent deterioration? Like we talked about, your patient may have all of these symptoms. However, if the medication they have ordered is going to further worsen your patient's condition, you're going to have to hold that medicine. Okay. And that's really it. If heart failure questions, if they've ever confused you, I hope that this video was helpful for you. And I want you to remember this. When you're looking at heart failure questions, is it fluid or is it a perfusion problem? And so comment fluid or perfusion if this framework kind of clarified it for you, and I really hope it did. And the next lesson, I'm going to do dysrhythmia basics, so you don't really have to memorize all those strips. All righty. So if you like this video, please like and subscribe, turn on your notifications, uh, because I'm really trying to do all of this, like I said before, to help you study smarter so you can test like a pro. And until next time, happy studying from NurseEdScholar.